turn every 2. What else are we doing to help skin integrity? Barrier creams, okay.
Keep them dry.
Okay, so the bed needs to be clean, dry, and intact, right? Okay, we can flip the heels. Now we need to be careful. If we have them on a special bed, we can't be putting all kinds of pillows and stuff because what's that do to the special bed then? Okay, especially if we're using an air mattress where we're letting air come up. If we start putting plastic on the bed, the air can't get where it needs to go. All right, so you got to be careful about that. You still would use pillows and stuff for your turning. All right, but you just need to be careful about that because otherwise you defeat the purpose. Okay, what else would we do to help skin? How do you help your skin? Lotion, right? What else? Okay, we got clean, dry, and intact. The bed, them. Okay, what else? What else do you guys do?
Make sure they get their bed baths.
Okay, so you want to make sure they get bed baths.
Proactive.
Yeah, we're going to work about nutrition, right? Nutrition is going to be a big thing because if they don't have good nutrition, especially about their total protein or their albumin is low, that's going to come up for skin integrity issues, right? All right, so we're going to look at that. So we might have to call dietarian, we might have to do a calorie count, we might have to do education, we might have to put them on a special diet, all those fun things. Okay, so nutrition, what else? Do I see it in this room? I do, some people have it.
Water.
Hydration, yeah, water. Okay? We're going to make sure that they drink good stuff. Okay, because in order for the body to function, we need to have all these things in place to keep the skin. All right? So besides skin, what else are we worried about? We started talking about respiratory. Right? And so we're going to turn. We're going to turn every 2. Remove those spirometry. They may, depending on where they're at, okay? So we'd have to do vent care if we needed to, and I'm just going to put this. Not everybody has to be on the ventilator, okay?
Oral here.
Absolutely. How often do I do that?
As often as we do it. Absolutely.
Every 2 or as needed. So you know when you go in and you're doing your we do every 1 hour checks now, but it used to be we do it every 2 hour checks. That would just be something on your 2 hour check. You go in, you look at your patient, you mouth care, you flip them, and you turn them, and you look at your IVs, and you move on. Okay? So your oral care, okay? This is very, very important, especially if they're on a vent. I'm not doing it. Okay? Yeah, IS is in sense from. Sorry about that. If I use something you don't know, just yell at me. All right, anything else that we want to do to help the respiratory? We would probably want who involved? RT. Okay? RT is really good. They might have other things going on. They might have, depending on what else, you might see them do some sort of other kind of type things for the respiratory. All right? Definitely you're going to make sure you do your lung sounds. Okay? All right, so besides skin and respirations, someone else who has a C injury, what else are we going to be doing? Range of motion. So that intervention, what would be the body system? Musculoskeletal. You do let me try and remember how to spell all that. So we're going to do range of motion. We already decided that was going to be passive, right? Who does that?
Actually, PT. Well, we can, but PT does.
PT will do that. They're going to come to your patient, right? And they're already going to be ordered for this. I mean, you won't have to do the consult. Okay, the physical therapy is going to come. They're going to do range of motion with them and positioning and things like that. Who else does this besides range of them? Because they only come once a day, and sometimes they don't even make it depending on what their schedule's like, right? Your nurse does. Okay. Could your PCA do this too? Yes. Your PCA could do this too. All right. So range of motion. How often are we going to get this done? Every 2. You could do it every 2 if you wanted. Probably every 4. Okay. Twice in your shift would be good. All right. Because what are we trying to prevent? Atrophy and what? Fractures, right? And so when we do this, what you will find that you probably not only will you have PT involved, but you also have OT. PT is strength, OT is activities of daily living. Okay, so if you can't keep this you probably want a team volunteer to help you with the functional pieces. They'll put them in splints and things like that so that the extremities are in functional positions, okay? So, and then when you have hand splints or you have splints, how do you take care of those? Right. You need to have a schedule, and they need to follow the schedule, right? So you can take them in and out, PCA can take them in and out. Your responsibility as the nurse, though, is to check the skin, right? To make sure that it's not rubbing, because they're not gonna be able to tell you that it's rubbing. Make sense? All right, so we could have splints, and then we maintain the splint schedule. This is very important, especially if once spinal shock goes through and you have some sort of gross motor movement, you certainly want them in some functional piece so that they can have as much function as possible. Okay.
You know, you were saying with, like, when they first come in, you have to put them in a brace until they get cleared. So say they are a lot of fluid, and then from that point on, is there, more damage that can be done? Like, how long do they stay in the brace? Because obviously someone who's paralyzed and in brace for life.
No, they're not, because what they do is they wait till once they clear them or they figure out what's going on, then they go and they stabilize it. So those fusions that we were talking about yesterday, they would go and then they would fuse it and stabilize it, and then they would be in the brace until that hardened, and then that would be done. Okay?
The chart I Jerry said, the charts are going through